So there's a lot more to really understanding how we treat pain by just blocking the signal from the periphery or just fixing the knee, because I've seen a lot of people who've had surgeries for their spine and they still have pain. Why? They're not talking about nutrition. Nobody talks to them about the fact that what they're eating plays a part in their pain. Smoking, drinking, unforgiveness, stress, not sleeping, the environmental toxin, all of that influence how the body process pain. So taking care of pain becomes not just looking at what's happening at your back or at your knee, but looking at the whole system, because what it is when it comes to pain, and hopefully everybody can take this away, is that pain is a protective mechanism. It is there to protect you. So when things are not going well, it is there to protect you. But when it goes on for too long, then things start becoming as dysregulated. It's not working as well.
Welcome to Harmonic Alignment,
a podcast that explores the new frontier of energy medicine,
bridging the gap between Western medicine and quantum physics,
giving you easy and practical solutions.
Guided by
me, Dr. Larisa Sharipova,
and me, Priscilla Koblenz. Join us on a journey discovering your harmonic alignment. On today's episode 64 of Harmonic Alignment, Dr. Larisa Sharipova connects with Dr. Asare Christian. Dr. Christian is a Harvard and Johns Hopkins-trained physician. He's specializing in pain management, performance enhancement, and health span optimization and longevity. He is the founder and medical director at Aether Medicine, that's spelled Aether Medicine, in Wayne, Pennsylvania. I am so excited for you guys to listen to this conversation because Dr. Christian started in the traditional path and he saw pain and he was treating pain, but people were always coming back. And he made that switch to really get into the functional medicine space to help people get to the root cause of their pain. And now he's really making a difference in his patients and his clients' lives, not only just healing their pain, but also helping them to live a long, vibrant life because he's working at the cellular level. He's going to dive deep into how pain actually affects you and what all the different mechanisms are and the root cause of most people's pain. And he's going to talk about some peptides and longevity and just a wealth of information when it comes to all the things we need to do. The basics have to be covered before you start working with someone, or when you're working with someone, they're supporting you on that journey. He spends time listening to his patients. So I think you're going to love this episode. Be sure to follow him on Instagram. He gives a lot of great content there. And check out his website at Aether Medicine, Aether Medicine.
Welcome to Harmonic Alignment Podcast. Today, I have a pleasure to have a conversation with Dr. Asare Christian, who is a Harvard and Johns Hopkins-trained physician specializing in integrative pain management, performance enhancement, and health span optimization. Welcome to the show, Dr. Christian.
Thank you so much, Dr. Larisa. It's an honor to be here. I know we go way back, and I'm excited to be back here again and talk about how we can help people with some educations.
Yes. Dr. Christian, your wealth of knowledge on many topics, but today I would like to talk about integrative approach to pain and specifically chronic pain, and as it the most common symptom that people seek medical care. So many people think of pain as a mechanical or structural issue, but we know that pain is much more than that. So tell us about different types of pain and your holistic view on pain, specifically chronic pain.
Yeah, so thank you for this question, because I think this is a very important topic that sometimes in this integrative space, we don't spend too much time on. One, I think either patients don't understand pain very well, or even sometimes clinicians don't understand pain very well. The definition of pain is an unpleasant sensory and emotional experience that may be associated with tissue damage or potential tissue damage. So when we look at the definition of pain, there is two components. There is a sensory component and there's an emotional component. And then the second part of that is that pain could be related to a tissue damage. You talk about structure, or there could be no tissue damage, right? Because we can have people in pain and we can do MRIs. We don't see anything else. We can look at their biomarkers. We don't see anything else. So there is something more beyond that. And it's also a personal experience. And that personal experience is influenced by various degree of your biology, your psychology, and your sociology. So it makes it more complex. And this is where we think providers need to kind of look at all of this meaning and try to understand how do you help the person in front of you going beyond just the structural things which we may not find to really understand what else is going on within their biology. Are they hormonally balanced? Are they eating something that's influencing their pain? I think this is a huge need for people to understand what pain is because it's one of the biggest public health issues we have in the country.
Give us an example what's a structural pain is and what's non-structural.
Yeah, so when most people have pain, maybe people have had back pain or knee pain, right? So that everybody understands, okay? So you went to pick up something, you bend over, and then you end up with this severe pain that's going down your leg, okay? So that is a pain that we consider to be a mechanical or structural pain. Structure in the context of, did you pull a muscle? Did you herniate a disc? Did you do something with your ligament? And one of the misconceptions that people have about structural pain or potentially back pain, let's use that example, is that a lot of times when people have back pain, 90% of the time, it's actually due to a strain or a pull on the muscle. It's not so much the disc or the spine itself. Everybody have any pain and you think, oh my gosh, it's my spine. Of course, we can do x-rays that may show some arthritis. We can do MRIs that may show some arthritis. But all of those things actually exist in most people without pain. And in fact, we've done studies where we've looked at individuals who have back pain. We do MRIs of their spine. They have normal MRIs. And then we have people who don't have any pain and we do MRIs of their spine and they have a lot of structural things. So the concept of structural pain relating to structure, yes, it's real, but we have to connect what we see on imaging plus what is actually happening in people's life. But a common example that people can relate to is like, maybe I have arthritis because my meniscus is torn, or maybe I have an ACL that's torn, or I pull something. So those are considered structured pain, right? But again, it's the source of it. That's what's creating that signal. That itself is not pain. Pain becomes more complex once it gets to the brain.
Yes, and also a lot of people complain about pain in one area, but actually the structural damage happening upstream, right? And
yes,
if we don't investigate upstream, we would always treat one area that is painful, but actually the damage or something is dysfunctional is in different area. Like many people see chiropractors all the time with one type of pain, or they go even for hip surgery, right? That is not necessary because the issue was in the lumbar spine, right? So there is a lot of things that we always consider, like, oh, where is the pain? And we go there and we do so many different things to one area, but don't look at the body in holistic way, right?
Yes, and that's an important point that you just brought up, because for people to really understand that pain is always an output of the brain, okay? Even though you feel pain in your knee, it's actually coming from your brain. You know, if you had a phantom pain, we can cut off people's leg and they can experience pain in the leg that's not there. So pain is always an output from the brain. So the very things that we're talking about, if somebody has some knee pain and we just go and put in some steroid or whatever into that knee joint, there are still other things that are perpetuating that pain cycle. That signal going all the way to your brain is being modulated or is being affected by specific cells. You have inflammatory cells in the periphery. You have cells in the spinal cord that are taking information. You have cells in the nerves. And all of those cells, how they function, whether they're going to increase your pain or make the pain more tolerable or able to be managed, depends on how healthy you are. So all of those cells, simple way, are also modulated by the gut microbiome, okay? Specifically, this astrocyte and microglia, these are the cells in the nervous system that propagate pain signal. So if you don't sleep, those cells don't work as well. If you have a lot of stress, they don't work as well. If you're not moving as much, those cells don't work as well. So there's a lot more to really understanding how we treat pain by just blocking the signal from the periphery or just fixing the knee, because I've seen a lot of people who've had surgeries for their spine and they still have pain. Why? They're not talking about nutrition. Nobody talks to them about the fact that what they're eating plays a part in their pain. Smoking, drinking, unforgiveness, stress, not sleeping, the environmental toxin, all of that influence how the body processes pain. So taking care of pain becomes not just looking at what's happening at your back or at your knee, but looking at the whole system, because what it is when it comes to pain, and hopefully everybody can take this away, is that pain is a protective mechanism. It is there to protect you. So when things are not going well, it is there to protect you. But when it goes on for too long, then things start becoming as dysregulated. It's not working as well. Okay. And we can talk a little bit more about that when it comes to chronic pain specifically, where even a small signal that is coming from your body because the pain has been there for too long, more than 3 months, that signal is perceived as very big. And that's the case of like fibromyalgia or something we call allodynia, where something that shouldn't cause pain actually creates a lot of pain. So it's more complex than how we've made people to believe and perceive. And people have so much power in modulating pain with your brain and with other things that they can do to optimize the overall health.
So if there is inflammation in the body, inflammation already creates pain. But having chronic inflammation in the body also increase the tolerance of pain, right? And sensitization of the body for the pain. To feel pain much more if you inflame, if you eat inflammatory food, if you don't sleep, all that creating probably neurologic response with the cortisol and all other chemicals in the body, which is making pain even worse.
Mm-hmm.
And you mentioned in the beginning, like perception of pain, right?
Yes.
Some people are more perceive pain than other, I guess, based on their genetics predisposition. Some people are more tolerant to pain, like I did a appendectomy with local anesthesia. So because my pain tolerance, I don't say to do it, but some people are more tolerant to pain than others. So it comes from our biology, right? But also our lifestyle create a different approach to pain and our social environment, right? You come from another country, we tolerate pain because pain is good because it's a warning signal, our body talking to us that pay attention. But here in the United States, we are afraid of any type of pain, right? We over-medicate and we self-medicate and do all different things. So what contributes to perception of pain? Maybe go deeper in that and what we can do about that.
Yeah, so that's a great question. So one is biology. The perception of pain is influenced by biology. So we know that there's individuals who have a predisposition to hypersensitivity to pain, and there's some that don't. And it's just a function of how their sodium channels work. So there's people who have that and some people who don't sense pain. And then we also have the very real case of people who actually cannot sense pain at all, which is actually not safe because pain is protective. And in fact, those individuals don't live very long because they can step on a nail and they don't even feel it. They have an infection, they don't feel it. The next time they know they're septic and they die, okay? So pain is important. So from a biological standpoint, there is changes in people's gene and how pain is processed and transmitted that influence the perception of pain. The other thing that also influences the perception of pain is neurotransmitters, right? So people may have more hyperactive state of neurotransmitters, glutamate, substance P, that makes them hyper, or they don't have anything that calms them down, so their perception of pain can be increased. And then a huge part of what also affects the perception of pain or how sensitive pain is experienced is also hormones. So sex hormones plays a huge part in how we experience pain. Interestingly, estrogen can make you sense more pain or less pain depending on what is going on. It's context specific. So estrogen is one of those things that maybe too much can make you perceive more pain. Too little can make you perceive more pain. Too little can take care of pain. Too high can also take care of pain. So it becomes one of those tricky things. But when it comes to progesterone, testosterone, DHEA, all of those are anti-inflammatory and also anti-nociceptive. They tend to dumb pain down. And consistently what we know is testosterone is actually what controls pain a little bit better. So when it comes to perception from the biology, there's genetics, there's hormonal influence, there's neurotransmitter imbalances. And even when it comes to chronic pain, this is going a little bit deeper. When you have chronic pain, there's always neurotransmitter imbalances. So ideally when pain is going up, you have glutamate that takes the pain up, and then you have GABA that suppresses the pain, or you have endogenous opioids that suppress the pain. When people have chronic pain, that system actually has flipped around, where now you have more glutamate and you have less GABA, okay? So all of that influences perception of pain. And then you talk about the other aspect, which is a psychological component. So your lived experience, your trauma experience, all of that influence how your brain and your body perceive pain, because pain is a protective mechanism. And when people don't feel safe, the nervous system is hyperactive. Every small thing becomes blown up, okay? So trauma is a huge part of, pain processing. And then the other side of it that you mentioned that's also important is pain is societal, where you grew up influence pain. And I always give this example. As Americans, we make up 4% of the world population, yet we use 80% of the world opioids. So are we the only people who feel pain? It's also cultural. It's the environment that we grew up in. If you grew up in a home where you were told, you can't express pain, people don't express pain. So there's all of these things that influence how we perceive pain. So we have to kind of put all of that together when we're looking at how do we get people to get out of pain based on their background, where they're coming from, and then looking at their psychology as well as deep down to their biology.
And also training physician, because
Yes.
I know when they train physicians that give comfort to any patient. So with little bit of pain, you just give opioids and all kind of painkillers, right? And of course, we use the most opioids in this country, and we have opioid crisis for the last few decades. So that's commercial medicine, I would say.
Absolutely. And then the other thing that's even relating to that is, I remember this is when I was like a resident or something, where they made pain a vital sign. Okay. So pain became the fifth vital sign. I don't know if you remember that, right? People don't even remember that anymore. So when we do vital signs, we check your heart rate, your blood pressure. These are the things that potentially can kill you. Pain is not going to kill you, okay? But somehow we made pain a vital sign, and this was a push for us to become focused on treating pain and pushing opioids. And this actually contributed to this expansion in opioid use disorder and the opioid crisis, which is taking so much life and caused such a huge public health issue. So the environment and how the culture determine things. When we say that, pain is a fifth vital sign, everybody start handling out opioids. But because if you don't, then you get what? Bad reviews. So I think it's important for doctors to kind of always step back. We are trained and we are given all of this expertise, but we have to be able to have agency and to be able to decide, right? We get guidelines, we get all of these things. What is the right thing to do for my patient? And it takes understanding that there's better ways to do things for you to be able to think outside of that, because most doctors are trained with what? Medications, injections, and surgeries, right? That's what we do. And if you don't understand how the gut plays a part in pain modulation, what are your options? Gabapentin, ibuprofen, opioids. So better education is needed for doctors. And then more importantly, we need to get our patients who are experiencing pain to understand this multifaceted nature of pain, and for them to understand that they control their experience of pain. If you can do something about your sleep, you can bring pain down. If you can do something about your stress, cortisol is pro-inflammatory. That can bring pain down. If you can eat well, that can control the pain. But we have to connect those dots for patients.
And you emphasize healing of pain at the cellular level. So can you explain how dysfunction at the cellular level contribute to chronic pain?
You're made up of cells, right? We're trillions of cells, and we're sitting here and we're talking, it's all a function of a cell, okay? And your cells have all this intelligence to adapt in a healthy way or unhealthy way based on whatever signal you give into the cell, okay? So you can give all these things, you can take all these supplements, you can take all these peptides, you can take all these hormones. Your cells is going to decide, is this the right thing I need to do? How am I going to use it? And it can downregulate, it can upregulate, okay? So when it comes to pain, and as in many of the disease or pathology that we deal with, it's all a function of a cell which has become dysregulated, okay? So for example, when we take a look at osteoarthritis of the knee, when you go to your doctor and you say you have osteoarthritis, they do x-rays and they go, oh, look, you have bone on bone. Let's do injection. You're still having pain. Okay, bone on bone, go get surgery, okay? At the cellular level, there's all these processes that are going on. There's mitochondria dysfunction. There is chondrosenescence. The cells in the cartilage, they are dying, and as we age, right? All of these things are going on. There's loss of autophagy. There's all of this cellular mechanism. There's inflammation. Inflammation is just one component of it. There's biomechanic deficit. There's neurotransmitter imbalances. There is changes in the brain. There's all of these things that influence that experience of pain. So if we just look at your x-ray and say just that, that's why we have all these people still in pain, despite all these advancements we have in America. So a better approach becomes really focusing on the cell. What can we do there? Can we improve mitochondria function? Yes. If we do that, the cells there can heal themselves. They can work a little bit better. Can we improve the oxygen of the environment, especially for a joint where we don't have a lot of oxygen, they don't have a lot of nutrients? Getting the cells those things, for example, using prolozone, using ozone, all of those things give the cells what it needs to be able to adapt. Same thing is happening in the brain. We talk about pain being a signal. And there is this processes that goes on. We have something called peripheral sensitization. You talk about central sensitization, right? All of those are function of a cell that is not working well. Okay. A cell should not be this hyperactive as an example. It needs to be here. But the reason why it's here is because it's getting these signals that are coming in that are getting it to be here to feel safe. If you're eating junk, the cell is not going to be here. If you're not sleeping, the cell is not going to be here. We want the cell to be here, okay? So the approach is, how do we give the cell the right signal so that it adapts in a healthy way to solve pain? And then when we approach it from that lens, not only are we improving pain, we are actually improving the whole system, right? Because we're improving the metabolic function of the cell. We're improving the immune system. We're improving cardiometabolic profile. So it's a different approach to really go to, let's figure out what we give to the cell so it can adapt in a healthy way. And it's all about the fundamentals, the sleep, the nutrition, the stress management. And then there's places for regenerative therapy. There's places for peptides. There's places for hormones. All of those things get the cells to do the right thing. And on top of that, there is also a place for blocking pain signal, okay? The pain signal blockade is what we do in conventional medicine. We give you a medication, we give you an injection. What is that doing? It's just blocking the signal. It's not really solving the underlying problem. So the underlying problem becomes, let's go and figure out what the cell needs so the cell can make the right decision. Because I'm sitting here talking, and it's a function of a cell. So a cellular medicine approach in a simplistic way, and hopefully I'm making sense, is to really focus on how do we signal the cell to become intelligent. And there's different cells, whether it's from the spine, whether it's from the knee joint, whether it's in the brain, whether it's in the gut. There's all these different cells, and they all seem to kind of work in the same way. They need energy. They need to perform optimally, and they need to be free from toxins and other stresses that get them to not act in an optimal way. So that's a quick, I guess, overview of cellular medicine and other things that people may be familiar with, exosomes, stem cells, PRP, all of those are like some type of cellular medicine. But those are just putting signals in. We need to do more to make the environment safe for those signals to work well, because a lot of times people are not healthy, and you put those things in their body, it doesn't work as well.
Mm-hmm. When you said about cells, we have millions of cells in the body.
Trillions, yes.
Health of the cell, it means we improving the whole body, not only knee or shoulder where we have pain, right?
Yeah.
So the pain management, when we localize it, it just go on one area. And maybe, yes, you inject the painkillers or hormones, it's treating one area. But when we improve cellular health, we improve the whole
system. Absolutely.
Not only treating pain, but we extending our lifespan. So it's become longevity, not just to heal a certain area or dealing with the health crisis, right? So it's like becoming health goal. If you address the cell, I also practice and do a lot of detoxifications. If you clean the cell gonna perform, and you don't need to do anything else. So you remove toxins from the cell, and cell can have a normal signals to do with hormones, and get in the cell good stuff and get from the cell, oxidative stress. So I think cellular health and cellular medicine is supposed to be on the upfront for all kind of diseases and health and specialties, I would say.
Absolutely. And it makes so much sense, because when you look at the cellular dysfunction that takes place in any disease, whatever symptoms that people are experiencing, is the same processes that are going on, okay? And you talk about aging. So people age, pain goes up. It's the same mechanism that drives aging, that also drives pain, that also drives Alzheimer's, that also drives cardiovascular disease. There is inflammation, there's mitochondrial dysfunction, there's loss of proteacesis, there's microbiome dysfunction. There's all of these cellular dysfunctions that are going on that then manifest either as pain, either as diabetes, either as obesity, and all of those things. So when we understand all of those principles and when we understand all of those pathways, it becomes a really good way to really get people healthy. As you know, the reason why I started my practice was I got tired of, injecting people. Yes, I can do injections and I can take care of your pain, but it's going to come back. So the approach became, how do we figure out a way to make people healthy? Because when you're healthy, the whole system is healthy, the cell is going to adapt. So it's really important for us to look at what is happening at the cellular level. So then we're not just improving pain. Like we said, we can improve diabetes. And that's what I see in my clinic now. People come in with pain and they tell me, oh, I have this problem here with my elbow. But I'm not just focusing on their elbow. I want to understand the whole system. Do you have insulin dysregulation? Do you have, cardiometabolic issues? Do you have other markers of inflammation? Do you have gut issues? All of that influence that. And more importantly, if I don't solve those things, I can fix your elbow pain, but you're going to end up with a heart attack. You're going to end up with some obesity. You're going to end up with something else that we have an opportunity to take care of when people come to our clinic. So it's a different approach, and I'm grateful that, I've kind of taken on this and learning how to better be able to be there for people, not just solving pain, but really solving health.
Yeah, I think every doctor should concentrate on cellular health, and I'm grateful.
Yes, every doctor should be a cellular health doctor. And it's also understanding cellular pathways. Once you understand those pathways, you can think for yourself. I don't have to use one thing to solve the problem. I can use this to signal the cell, because this is what the pathway is. It's NF-kappa beta. What else can I do? Well, I can do some peptides. I can do some hormones. I can do some anti-inflammatories. I can do some, omegas and whatever it is. So really understanding cellular pathways, which is what we learn in medical school, but then we don't practice it, so we lose it. Once you become a resident and you're practicing, it becomes, this is the disease, this is the medicine. This is the disease, this is the medicine. Without thinking about what else is going on, what is dysregulated, that can be fixed. And when we fix that, then the cell can even do more than whatever the underlying problem that people are showing up with.
Mm-hmm. Even in medical school, when you learn it, you don't have any put in the body, how body works. They teach us so confusing that you cannot even relate to disease, first of all, and to the body. It's so functional. Same biochemistry. Then I learn much more now biochemistry than I in medical school, because now you have all the biochemical processes, the pathways, the enzymes, the cofactors, makes sense when you look in the different perspectives.
When you're going through, like you said, we're going through medical school and you learn all of these things and you're just like trying to pass a test. You don't even know how that applies to a human health. Okay. And then when you get to the place where you're actually taking care of people, so those things are done outside of context. We're just learning all these pathways and Krebs cycle and mitochondria, blah, 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 all of these things that now, like you said, now we actually like, oh my gosh, the mitochondria is so involved. It's all about the energy of the cell. Okay. So understanding the mitochondria beyond its bioenergetics is like so important. It signals, it does everything. But, when we're there, we don't have the context of how that influences health. And then when you get to the place when you're actually interacting with human beings where you're going to take care of them, the focus shifts from health. You're solving sickness. When you're a resident, where do you do residency? In hospitals, in clinics. And what are we doing there? We are solving sickness. People come in, they're already sick. That's not when you're talking about nutrition. That's not when you're talking about biochemical pathways and what you can do. You're just trying to save life. And then we get out and that's all we know. We lose the fundamentals. So it takes going back to relearn all of these things, which is what we are in this space doing, because you have to go back and go learn and then figure out how you can put it all into context to help your people.
And they teach disease care, right? That's what our medical system is, but instead of health care, that's what we are trying to do right now, right? When we become different practitioners and live in the conventional medical system, because it's not for the health. And we mentioned stress. Even you live in pain, it creates stress. And pain, it's a physical stress and emotional stress combined together. And specifically, if you live with pain for a long time, it's become a snowball effect. Tell us how you deal with that chronic stress that people experience related to pain, or chronic stress that become a pain. How you help solve that.
So that's an important concept for people to understand. And it relates to function of how pain is connected to emotion and cognition, okay? So when pain goes to the brain, the area that pain is being processed is also tied to your emotion and tied to your cognition. And a simple way that I'm able to explain this to my patients and for people to understand is to ask yourself, how do you feel about your pain when you're sad? Your pain goes up. How do you feel about your pain when you're doing something, you're distracted and you're having fun? You don't even think about it, okay? So pain is always influenced by our emotions and our thoughts. Cognition, your thoughts, what you're thinking about. This pain is killing me. This pain is never going to get better. The words that you use, all of that actually makes the pain hyperactive, okay? So this is a place for people to understand that, yes, that emotional component plays a huge role in how we experience pain. This is like the bigger picture: emotion, cognition, pain. But the very thing that you're talking about, which is connected to all of these three, is stress response, right? So when you have stress response, cortisol goes up. Cortisol, that's what? It's pro-inflammatory. It makes everything hyperactive. It makes hypervigilance. It makes the pain worse, okay? And then we also know that when people have pain, the pain then creates stress because pain is like a safety mechanism, but if it's chronic, it becomes unsafety. Why am I having this pain? Do I have cancer? Do I have this? People have all this fear when they have pain, and that alone can create cortisol. So it's this cycle of the pain, the fear, the cortisol, and it just keep looping in, okay? And it's also important for people to recognize, and this is actually based on one of the therapies, cognitive therapies that are very good for pain, called pain reprocessing therapy. And basically pain is a signal plus fear, okay? So it's just a signal plus fear. When you take away the fear, it's just a signal. And we can do something called somatic tracking where you can just sit down and you can just experience the pain. It's just a signal. You can close your eyes, feel it in your knee, you can move it around, and then you go, oh, it's just a signal. But it's the fear. What does this mean? Every time we have pain, something is wrong. And pain has multiple meaning. Pain always means you got to pay attention to something. And then it has spiritual meaning. It has context and culture. In other cultures, they see pain as a way to grow. Not just like pain, that physical pain, but emotional pain. And sometimes emotional pain will manifest as physical pain. And physical pain can manifest as an emotional pain. And I can even give people an example of this. And this is all based in science. This is not anything that we're just making up, okay? So recently my knee just blew up. I had this severe knee pain and there was nothing to explain the pain except there was all this stresses and all these things that I was trying to do. I was trying to study for 2 board examinations. I was trying to run a business. And my body goes, hey, dude, you got to chill. Okay. So sometimes the pain is there to tell us something, to pause, to listen, because we don't listen. And the body is always going to be like, okay, I got to stop you to pay attention. So cognition, emotion, having good thoughts about your pain would decrease your pain. Having good affect, good emotions can also improve your pain. So it's all connected.
So what do you advise to your clients?
What I tell people is that 1, you can control your thoughts. Okay. Emotions, maybe that's hard to do, but you can control how you talk about the pain or how you feel about the pain and what kind of meaning you give to the pain. If you sit there and you go, this pain is killing me, this pain is killing me. Yeah, your words are going to, translate to that vibration. Okay. So having some good way and say how you even talk about the pain. You went and did a walk. People have chronic pain. They walk and it's like, oh my gosh, I'm all flared up. So understanding how we talk about the pain, I did some exercise. I'm going to have some soreness. I'm going to take it easy. I'm going to relax. I'm going to chill. I'm going to watch Netflix. I'm going to do something that's soothing for myself. I'm not going to curse the person who did this to me 20 years ago, or the car accident that happened 5 years ago, 10 years ago. If it wasn't for this, the unforgiveness, all of that keeps pain in place. Okay. So getting people to talk in a positive way about their pain helps with pain. Not getting so upset when you're mad, when you do all those things, those don't help. The painfulness of the pain goes up. Okay. And there's always things that you can do about pain. And a lot of times when people come to me and they have pain, it's not so much the pain that they are worried about. It's the limitation that the pain placed on them. That is the biggest issue, the function. I can't go here. I can't do this. If I just have to deal with the pain, it was fine. But I have to go to my daughter's graduation. I have to go do these things. And figuring out a way to focus on the functional goals, then the pain becomes irrelevant. Yeah, pain sometimes can be there, but it's like, oh my gosh, yeah, I can still go to the party. I just have to have a plan, okay? So I give people strategies. If you still want to do it, go to the event. Don't sit here and go, I cannot go here because when I sit for 20 minutes, I have pain. Go sit for 10 minutes and get up and walk around. Giving people direction, giving people strategies is what I tend to offer my patients. But fundamentally, I try to get them to start with understanding what pain is. You have to understand pain. Pain is a subjective experience. So you, the person, the subject, have to understand what it is, because you have all the knowledge of what's keeping you in pain. Because a lot of times people don't know what's keeping them in pain, okay? And I'll tell them it's a function of your health. If you're eating junk, you're going to continue to have pain. If you're not sleeping well, you're going to continue to have pain. If you have hormonal dysregulation, you're going to continue to have pain. If you have biomechanical deficits that we're not working on, you're going to continue to have pain, okay? So if muscles are weak, you will continue to have pain. So sometimes we also have to go beyond just this passive modalities. Yes, acupuncture feels great. Yes, chiropractic manipulation feels great, but you still have to strengthen muscles, okay? Sometimes people are not even open to the reasons why they're experiencing the pain, okay? And I could have just been like, yeah, my knee is blown up. I mean, I'm a biomedical guy, and it's like, okay, it's inflammation. But I knew that, yes, there's something else that my body is telling me, and we have to be open to that. Okay. So all of those things become education. And once you have that, you can connect the dots. People will say, I don't know why I woke up this day and my migraine is worse. And I ask them, what did you eat in the last 48 hours? Oh, I went to a party, I had a pizza and I had a beer. Okay. You start connecting the dots. Anytime I eat pizza, my migraine acts up. Okay. You don't need to go take more medications. Stop eating pizza. Okay. So it's really this self-recovery thing that we need to do with people. And it's all about learning what is influencing your pain, because what starts the pain and what keeps you in pain is totally different things. And people need to recognize that. So there's a predisposing factor, precipitating factor, and perpetuating factor. The perpetuating factor is what people need to dial in and to understand. And all of that is a function of your health.
Wow.
Yes.
A lot of education for sure.
Of course.
Are there specific diagnostic tools or biomarkers you use to assess cellular health and guide personalized treatment to treat pain?
Something that I've started doing in my practice now is I do this thing called the health assessment panel. Okay. So it's a very comprehensive panel that looks at not just the inflammatory markers, it looks at autoimmune, it looks at hormones, it looks at nutrition, it looks at gut, it looks at mitochondria, it looks at cardiometabolic. And the analogy I give to people is that there are two types. I'll answer the question, and I want to make this clear so people understand what I do here that's different, is that there are two types of car mechanics. If your light bulb went off on your car and you go to a mechanic, there's one mechanic who is just going to replace the light bulb and send you on your way. Okay. There's a second mechanic who is going to ask the question, why is your light bulb out? Is it your wires? Is it your battery? And more importantly, this is a car. Is your transmission working? Are your brakes working? Those are the things that are actually, when they go wrong, is going to get you stuck or going to get you killed than the light bulb. Okay. So people come to us and they have a complaint, they have a symptom, they don't understand what is going on within the whole system. So what we start is this comprehensive assessment that look at all of those systems, because when those systems are not working well, we can patch you up and go. You're going to keep coming back. You're going to come back and maybe your light bulb will actually blow up, because why? The wires was already not working very well. Okay. So we do that assessment, look at all of those things. Hormones plays a part in your pain, thyroid function, inflammation, all of that. And we put that together to be able to have a starting point, and then educating people about those are just the biomarkers. Those are just the biological lens, right? There's the psychology, there's the sociology, and all of that have to be put in place. But a good objective place is to look at a comprehensive system to give us where you are and what we can do to kind of help you move forward.
So you look at the cellular health of
cellular health, the nutritional status of the cell, how the cell is using signal. If you don't have hormones, the cells don't have the signal to be able to do what they need to do. If you have too much insulin, if your pancreatic cells are not working well, that is going to influence glycation. That's going to influence pain. And all of that, not just influencing pain, it's influencing your metabolic health, it's influencing your cardiovascular health, it's influencing brain health, it's influencing aging. So the approach is, let's get to the root. Let's solve all of those things. The pain is a simple thing to solve. Okay. But let's solve the things that's actually going to kill you. So that's what we do. And it's a 2-visit. We do the first visit, 60 minutes with you, get all of that information. Yes, I'm going to take care of your elbow pain. That's not a big issue for me. Okay. But let's look at the whole system. What else do we need to optimize? And then the second visit, we sit down, review all these labs that actually are well-validated labs that mean something for your health. We do a lot of labs, as you know, in functional medicine. And a lot of times, like, people do all of these labs and they keep going around and going, I still have the same issue. Okay. So more importantly, I also listen to people than just looking at their biology and their labs.
And so after you do the assessment, I know you use different types of therapies. Let's talk about peptide therapy. What exactly are peptides and how do they help in pain relief and tissue repair?
Yeah. So peptides are basically amino acid sequences that are put together by the body to communicate a specific function. And the simplest way that I try to understand or I try to explain this to people is that in medicine, we have different ways of kind of solving health or solving disease. Okay. So we can give you some supplement. Everybody understands supplement. we can give you a small molecule. Small molecule is anything that we make, pharmaceutical company drugs that we make that your body doesn't make, okay? So aspirin, metformin, a lot of the drugs that we have are small molecules. And then we have peptides. So peptides are also pharmaceutical agents that we can make, but the same thing also exists in your body. And then we have biologics and other things, proteins that we can use. But so peptides kind of fit into this paradigm of things that we can use to help you heal. But the good thing about peptides is that your body makes the same thing. So when we put that into your body can see it, it can use it, it can signal the cell, gives the information to the cell. The cell say, okay, I got the signal. I'm going to do what I need to do. And then it moves on. Okay. So it tends to have less side effect. So in the context of pain and regenerative medicine, people come in and they have pain. There is immune dysregulation. There is neuroinflammation. There is neurogenic inflammation. There's all these processes that are going on. I can use peptides to modulate that. So I can use thymosin alpha-1. It's a type of peptide. There's thymolin. These are all immune peptide. There's thymosin beta-4 that helps to heal things a little bit faster. There's BPC-157, which everybody has heard of. It's also good for tissue repair and angiogenesis and all of these things that the body needs to heal itself. And then beyond that, trying to understand the bigger picture of what else is going on in people's life? If people are not sleeping, pain doesn't get better. Can I use a peptide to signal the cell to get better sleep? I can use CJC epimorelin, deep delta sleep, get people to sleep, or I can use VIP, another peptide. So there's all of these things that we can use to reset circadian rhythm, fix the gut. There's a peptide called larazotide. There is IL-37. The BPC is also very good for the gut, an oral formulation. So this is a whole bunch of peptides that we can use. And then it becomes really understanding the science and the art. It's not just stacking peptides. And I see that done all the time. People go to podcasts and they hear somebody say, oh, this is a peptide and this. There's a place for all of them, okay? So if somebody is not sleeping well and I'm giving you some peptides that's supposed to help you heal, if you're not getting to good delta sleep to turn on your own, antioxidant processes and growth hormones, your outcome from those peptides are not going to be as great. So it's important to kind of focus on the fundamentals. So we can use peptides to help you with that. We can use peptides to modulate metabolic profile. If people have high sugars and they're, inflamed and all of those things, we can use peptides to solve that. And in fact, one of the peptides that I use for pain is GLP-1s. So I use semaglutide for pain. It is even before it became such a big thing in people using it for weight loss, because I understood cellular pathways and I know that influence the polarity of the cell in modulating inflammation. So I have a lot of patients who have autoimmune issues, and we're able to use a small dose, not the dose for weight loss, but the dose that modulate inflammation, modulate the efficiency of the cell to be able to take care of itself. So tons of peptides out there, and basically much safer than the traditional small molecules that we have. And they also tend to be more targeted, because the limitation that we have with supplements, yes, I take tons of supplements, they're great, but a lot of times it's a function of, the potency of it. Does it even get absorbed? A lot of people have dysfunctional bowels where they are not even absorbing it. And then we also know that as we age, we don't even absorb things as well. So there's all of these other factors that has to be put in place. But when you're using a peptide, it's bypassing the GI tract most of the time. It's an injectable. You get it to the cell. It gets there directly, and it speaks to it. It tells us what to do. And then the great thing that I like about peptides is it's not something that you have to take forever. A lot of pharmaceutical drugs, we put you on a drug and we want you to take it forever, because that's the business model, okay? Peptides get you to heal, and then you move on, provided you're doing all the basics and the fundamentals to help you to stay healthy.
How long usually you put people on a peptide?
About 3 to 6 months, depending on what we're working on.
And of course, it's not only using peptides, because if you don't change your lifestyle, if you don't change nutrition, peptides would not work anyway.
They don't work in vacuum, exactly.
Money just do peptides. You have to do all other things as well. Correct?
You have to do the exercise, you have to dial in the sleep, and all of these therapies that we're talking about, none of them work in vacuum. And I think that's the misconception that people have, because in conventional medicine, we just give you a pill and then we send you on your way. Take your metformin for your diabetes. Nobody talks to you about nutrition, exercise, what to do after you eat, how to eat, all of those things, right? And even those things, when we can give people some guidance on what to do with them, they actually do better. So all those interventions that we do in medicine, people have better outcomes when they have better resilience. And the resilience is a function of their health. So those things have to be in place, and then everything take you a little bit further. Hormones, same thing. And I also use hormone to treat pain. Testosterone is anti-inflammatory, it's analgesic. It has all of these benefits that people need to experience when they're going through menopause. I see all these women come in, they have pain, they're not sleeping, they're gaining weight. What do they get from their doctor? They get antidepressants, they get put on sleep medications, they get put on pain medications, and they're gaining more weight. And all they need is a little progesterone. Okay. So this is going to the cell, giving the cell what it needs and what it's lacking so it can take care of itself. And then all of those things become healthy.
Do you use hormone optimization differently than conventional hormone replacement therapy, or you use the same way?
So I use the same way, but I do bioidentical hormones. And it's also really trying to understand, like, what are we doing with hormones? Okay. Hormones don't work in vacuums. A lot of times when people have hormonal dysregulation, it's important to understand why. Of course, the why is always aging, right? As we age, but we also know that we are in this environment where there's a lot of hormonal disruptors with our activities. A lot of stress will influence hormones. A lot of gut dysbiosis will influence hormones. And all of that has to be taken into account, okay? So when we just give you a hormone and we're not looking to the source of why this is occurring, we're not helping people. There's people who feel good on hormones for a while and then eventually they don't. Why? They have mitochondria dysfunction that nobody's addressing for them, okay? So people need to be educated. So it's about using all of those things as signals. When do we use it? How do we use it? How do you dose it for the person in front of you? Everybody's individualized. There's people that I can start on peptides before we even get to hormones. Let's fix your metabolic issues. And I've had patients where I put them on hormones to try to get them to lose weight. They actually gain more weight. And I was like, okay, we went around, we switched it around, we did the GLP-1s. Then we get them back on the hormones and it's a whole different ballgame. So it's really kind of knowing where to use it, how to use it. And it's all about educating people about the fundamentals. You cannot have hormonal balance until you balance your life. Okay, so that has to be the first place to start and, give people options. And the options we have are broad from, topical applications, pellets, injections, anything. But all of that is bioidentical, and giving people the structure and what they need to understand as part of this is get your shit together, stay healthy, and then all of this things works a little bit better. Okay.
I think it's go back to the basic, the cellular health. So if you optimize cell, maybe you don't even need hormones, right?
Exactly, because even how you make hormones, right? You take cholesterol and you make progesterone. Where does that take place? In the mitochondria. So I can improve the mitochondria health of a peptide, and that actually improves people's hormonal levels, right? So it's not just like giving them hormones. There's other things that we can do because not everybody is like a candidate for hormone. For example, young people who want to be able to be reproductive and continue to make babies, you can't give them testosterone. So what can we do? I can work on their mitochondria. I can work on providing a peptide, kisspeptin, that can influence the gonadotropic releasing hormone. So there's all of these things that we can do, and it's all about understanding how you signal the cell in a healthy way to give you the outcomes that you're looking for.
Mm-hmm. And signals of cell, if cells is inflamed because of the toxins, right, it's not going to get
it's not going to work, exactly.
So
or if it doesn't have the nutrients it needs, right? So the macronutrients, the toxins, you have to kind of get into all of that. And the way I look at this is like, we start up here. And then if people are not getting better, then let's get in there. Definitely, there's always toxins that our body is trying to get rid of. A lot of times we have the resilience, but a lot of times people need help to be able to then perform where they need to be.
Specifically lately, maybe for last decade, even less, a lot of women get on the bioidentical hormone wagon. And now you can even get prescription online. You don't even see the doctor and it will send to your home. But if you don't optimize your cell, you don't change your lifestyle, then what's the point? It's again, same thing, like you're taking medications.
And people miss the boat on that. You definitely want to see a physician, a clinician who can monitor these things for you. They appear to be benign, but they can also create a lot of problems. The body is a system of systems. And we need to understand your insulin. We need to understand your thyroid. We need to understand all of those things talk to each other. Cortisol, all of those are talking to the sex hormone. So it's a symphony. And if people are just going to places where they're just getting, because it's cheap, because they don't want to pay for a provider, if people want to do that, that's okay. Because you have to value your health. And then we have to do things in the context of you, the individual. Even though hormones are great, even though peptides are great, the peptide that's going to be good for me may not be good for you, Larisa, okay? And even when things are safe, what is safe for me may not be safe for you. So it's really important for people to understand that you need to see a clinician who have that context. What I do is, it's not like an experiment, but by default and being a doctor and seeing thousands of people, I see how all of these signals takes place in people, okay? Because there's evidence that we know about, we follow the evidence, and then you come and you apply it and it doesn't work, okay? So it's knowing people how to address and how to manage who's in front of you. And that takes skills, that takes special interaction, and it takes building relationship. Part of what we do as clinician in helping people to heal is trust. Okay. So if you're just going online and you don't know who it is, and actually I see a lot of patients who go and get all of these things, they have side effect, nobody's getting back to them, and then they come back to me for me to help them out. So it's great that we have access to that, but people need to do these things right. And hormones can be done very cheaply. That I think, go see a doctor, come see me, go see Larisa, whoever is out there. There's so many of us out here who can help people navigate.
And it's personalized approach when you work with someone, so they know your body.
Yes.
My issue with bioidentical even hormones, nobody tests how you eliminate hormones. Are you detoxifying your estrogen? Are you, prone to one way of metabolize to another? Nobody is looking into that. So it's a big issue, and I have a lot of concern about it.
Yes. All of that has to be done well. I mean, the issue with hormones, like you said, is like, it's great. There's a lot of confusion thing about it. But yes, we have to look at how you're metabolizing estrogen, because that can implicate DNA damage, and that can implicate potential oncogenic activation or cancer or whatever it is. Okay. So those things are important. You got to be moving your bowels, detoxification. Phase 3. If you don't move your bowels, you're constipated and you're taking hormones, you're reabsorbing everything back in there. Okay. So all of those things need to be done. And you have to go to a provider who understands all of those things. There's nuances with topical application, oral application. And the whole idea is like, it's just so confusing, but it can be done. If you go to a provider who understands what they're doing, they can guide you in a way that makes sense. And that's what we do here. I've spent a lot of time studying these things. I mean, hormones was that one thing that I spent like 3 years because it was so confusing. And then once I got it, I was like, oh my God, this is like the simplest thing, yet it's so confusing. Oh, you can do a patch. You can do this. You can do this. But you learn, and then you go back into the literature, and then you find out and you put it all together. So what I've come to is that it's about really taking the time to understand the limitation. There's a place for all the things that we do. What are the limitations? Who are the right persons for? Okay. I do pellets. Pellets is not for everybody, but pellets is also great for a lot of people, and people are afraid of it. Okay. Because they don't do it, or because if somebody else have had a bad experience with it. Okay. There's topical applications. How do you do it? There's worries with transference that you have to think about. Okay. There's oral applications. You have to worry about maybe the liver a little bit. Even now, everything is quite safe. Okay. There's injections. There's limitations there. So it's really kind of knowing what we have, how does it work, who is it going to work in better, and what are the limitations, so that people have the right thing that's help them to signal the cell the right way.
For someone listening who has tried everything and still live in pain, what message of hope or direction would you want to offer?
So one, I would say that pain can be healed. Okay, so you have to kind of first start with hope. Okay, because a lot of times people have had pain for so long, they've gone to doctors, they've had imaging, they've done surgeries, they are still in pain. Okay, but it's all a function of a cell that has become dysregulated. And a lot of times there's multiple things that's influencing that, and you have to get in front of a provider who can help you with it. But first thing I would say is, one, educate yourself about what pain is. The science of pain, or the neuroscience of pain, is very, very important. And in fact, is considered part of treatment, even though we don't give it to people. So people that come to me, I give them this app called Curable that gives you a neuroscience education and gets you to understand what pain is. And then 2, it's all about the health of a cell. What is perpetuating your pain is different from what started your pain. And realizing and recognizing what's keeping you in pain becomes important. Then you can get rid of it. What is it? Sleep, stress, unforgiveness, poor diet, the environment. Okay. All of that influence. And then who are you around? Sociology. There's people who don't make you feel great. You need to move away from those people. Okay. So those are all things that you have control. And then last thing is get in front of a doctor who understands, who can listen to you. And that's what I do. One of the things I do well with my patient is I listen. And sometimes that's all it is. People just need to be heard. The healing can take place within yourself. When you feel safe, your body have all the intelligence. It's not me. It's the intelligence of the cell. And how do we respect that? And it comes when you feel safe. So all of those things are there. And it's not just going to be medication. There can be a place for medication. There can be a place for hormones. There could be a place for peptides. And there's a place for getting muscles to be stronger. Okay. all of those things. And then the neuroaffective component, psychological help, is also important to help with people dealing with chronic pain. So there's hope, and pain can be held when we look at a bigger lens of treatment and assessment.
And unfortunately, you cannot do that as a doctor in 7 minutes, as we usually go to.
Yes. So you have to have a doctor who can spend the time. And I think that's where, we have this space where we can't take insurance, because insurance doesn't reward that. Insurance wants me to spend 7 minutes with you, so that doesn't work. So you have to go to a doctor who can really spend the time with you, because a lot of times people suffer unnecessarily. I've seen patients with migraines and all of these things, and all they had was like some GI dysfunction that needed to be solved. Insurance was not getting us to approve the medication. All these people in the healthcare system that were struggling, we were fighting with insurance, right? He gets here, we check his gut, dysbiosis, solve it, migraine is gone. I see that over and over and over and over. And if you have chronic pain, you got to check your gut. I mean, the gut is a huge part in modulation of pain. So I go to a doctor who understands that. Better yet, come see me here in the local area in Wayne. And it's all about optimizing your overall health, not just your pain. I'm going to get you better, and I get you to live longer too. Yes.
So tell more how people can reach to you and come to see you, or if you see people online as well.
Yeah, so as we briefly introduced, my name is Asare Christian. I'm Dr. Christian. I'm the founder of Aether Medicine. So Aether Medicine is an integrative and cellular medicine practice in Wayne, Philadelphia, that focus on cellular health to get people to improve their pain, improve their performance, and improve their lifespan. A good way for people to connect with us is to look us up on the internet. Our website is ethermedicine.com. So it's Aether, AETHER, medicine.com. People can also call us for appointment, 484-806-1101. Or people can also follow us on Instagram. Everybody's on Instagram now. So Aether_medicine, and I provide education. I like to learn. I like to collaborate with people. So even providers out there who have patients and want to talk about them, I'm open to having that discussion as well.
Go follow Dr. Christian on Instagram. He has fun videos. I love watching his videos.
Yes, thank you.
Last question. Our podcast name is Harmonic Alignment.
Yes.
What does harmonic alignment mean to you?
Harmonic alignment. I love that. So I think it relates to everything that we're talking about. If you are off alignment, pain will not get better. Okay. And harmonic alignment even goes to the very thing we're talking about, cellular medicine. Okay. So when we take a cell, the smallest unit of the whole body, we go into a little bit, we see mitochondria, we see all of these things. And then we go a little bit deeper into all of those things. And then we see atoms. We go a little bit deeper and we're seeing, protons. And then we go a little bit deeper, we're getting into the quantum. And we go a little bit deeper and there's just vibration. There's emptiness. There's nothing there. Okay. So at the source of all of this is vibration, and things are always in harmony. Okay. And things are moving. And if we can get things to align, then the cell can heal. When the cell heals beyond the cell, which is what we're talking about, then everything even gets better, because now we even get into quantum biology. So I love that you have this contest for your podcast, and it relates to everything that we're talking about here, that when there's harmony, when there's alignment, when things are in where they need to be, when the cell has all that information in alignment, healing happens.
Beautiful. Thank you for explanation. And
Yeah.
I'm so glad that now doctors like you, right, Harvard educated and all those big institutions talking about quantum biology now.
Absolutely. Yes.
I'm practicing now too. So everything is energy. And it was great talking to you. Thank you for all your wisdom.
Yes. Thank you so much for having me. Appreciate it.
Are you ready for your Energy for Life bioenergetic nest scan? Dr. Larisa Sharapova and myself, Priscilla Koblenz, offer personal, private, 90-minute consults to get you back to optimal health and well-being. For more details, visit the show notes or check out harmonicalignment.co. We hope you enjoyed today's episode of Harmonic Alignment. If something resonated with you, we would love to hear about it. Please consider leaving us a 5-star review and subscribing so you don't miss an upcoming episode. Thank you. The information contained in this podcast is provided for informational purposes only and not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and directions. The products and information received through the podcast should not be used to replace a consultation or advice from your healthcare provider. If you suspect you have a medical problem or have any healthcare questions, please promptly call your healthcare provider. This podcast, including Dr. Larisa Sharapova and Priscilla Koblenz, and the producers are not responsible for any possible adverse effects from the use of information contained in this podcast. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct financial benefit to the product or services referenced.